Hello group, this is Dr. Turpin. We're going to review health and illness and health promotion, and I'll try to give you a little bit of content on this so that as there will be a few questions on this on the test, but not massive amounts, but I do want you to get the underlying basic things about health and illness and health promotion in particular, because there's lots of health promotion that goes on in nursing that you need to be really adept at and know the difference in terms of treating illness like we typically think of in the acute care setting where you're spending lots of time, and then health promotion can be very different in terms of the expectations. So these are common images of what we think health may be or how people experience health and illness. You know, we see somebody with a beautiful body and we think of that person having the picture of health. We view health as completely lack of illness, but for many people, lack of illness is not really health. They have adapted, and so while they've got some level of illness, they still consider themselves to be healthy. Of course, we are bombarded all the time with memberships, procedures, apps, all different kinds of things, medications, supplements, things that we can purchase that will supposedly keep us or make us healthy. Some of those are good for us, and some of those we don't know, but there's a huge market in terms of trying to consider us ways for us to stay or become more healthy. Being healthy is an ideal goal, but it may not ever be reached by people, by all people. And it is kind of a mindset of always striving to attain it. And by doing so, we are the healthiest that we can individually be. And so that is a way for people to kind of think about that and talk with clients about is, you may not ever reach every goal, but if you're doing things that are physically good for you, that are healthy activities, then you're doing the best that you can to be as healthy as you can. And then there's this idea that, people want to have the strength to live and, not be ill all the time. And, our mind, our body, and our spirit all together work interchangeably to kind of give us a sense of health and well-being. So often it takes that spirit or mind-body connection for someone to be able to experience what they consider health. So there's a huge continuum between health and illness, and everything is individual to the person. Patients usually will not describe illness as a medical diagnosis, and that's probably where we can learn from that. Every time we give a report on a patient, we are defining patients by their diagnoses. But patients really describe illness more as how do they feel, and that's very unique to individuals. So nurses have to kind of understand that when you're asking them about their level of wellness or whether they feel healthy, they may have 2 or 3 chronic diseases and tell you they feel good. And so we have to kind of honor and establish what that is for each individual when we're working with them, and not describe actions just based on medical diagnoses. So health and illness includes all these different things, many of which we've already talked about in other classes. Biological factors, nutrition is key, and not just in the sense of losing weight or staying healthy from a diet perspective, but if you think about clients in underserved countries or underserved areas of our country, people's nutrition is varied. It's not what we may experience. There's lots of children, even in our own country, that are very hungry and not getting fed proper foods. And some are getting fed foods that create, the ongoing obesity in our country. So but then there are other countries where kids and adults alike suffer drastically because of the lack of food, the types of food, from a malnutrition standpoint. Physical activity, sleep and rest, we've already talked a little bit about. Having meaningful work and people feeling productive can really help someone sometimes cope and see themselves as more healthy. But whenever they lose the ability to have that meaningful work, they may kind of feel like they've succumbed to their illness. I have a lady friend that just had to finally quit her job because she has metastatic cancer, and she's been on Facebook talking about, how that impacted her leaving the work setting. And so that is a real thing, not only just from that part of it, but also from a financial standpoint, and how well can you pay to take care of your disease if you don't have health insurance anymore because you've had to leave a job, and or you don't have the finances to pay for the care that you need. Lifestyle, environment, and of course all the things we talked about with family relationships and other relationships in terms of support systems, and then culture, spirituality, and religion. These are what they consider disruptions to health. Of course, we always think of disease disrupts health. Injuries can disrupt health and can be very sudden. Mental health can have a huge impact on how you perceive health. And it can create a stigma of I'm never going to be healthy because of this ongoing disease. Of course, people having pain, loss, fear of death can kind of really disrupt their mindset towards health. We have lots of competing demands in life now where people have a lot of difficulty with trying to adopt healthy behaviors because of how busy they are or how complex their lifestyle is, and many people also fear the unknown. And so that's why when we talked about doing patient and family teaching, how very important it is to really demystify a lot of diseases and how significant or what impact they're going to have on their life by doing a lot of education, because they may just be stuck with not doing anything one way or the other because of fear of the unknown. And then we know with patients that live alone, feel isolated, don't have support systems, when they have issues with their health, they do not handle that as well or do not have the resources to manage diseases or illnesses. This is just a slide that kind of outlines the difference between acute and chronic illness. When we think of having an acute illness, we think of it as something very time limited that could be minor, could be serious, but we expect that you can recover from it. And chronic illness is over a long period of time, sometimes a lifetime. It really requires life changes to manage a chronic illness. And so that is where the rubber hits the road with self-management of disease, and getting people to agree to that is a big turning point of I have to take responsibility and accountability for that. Of course, chronic disease patients are going to be on the ongoing care of a doctor. They may be on medications, may be on specific diets, may have other tasks or things they have to do to manage their disease. And they may experience times with the chronic illness that it's sort of stable for a little while, and then it might exacerbate, and then lots of times with chronic disease, with every exacerbation of the illness, then when you try to recover them back, they may or may not be able to recover exactly back to the same baseline that they were at before. In fact, you may see this kind of gradual have an exacerbation, don't get quite back to the level of health I was at, but I'm at a tolerable stage or accepted stage, and then the next exacerbation, it's worse, and then you kind of stair step in a way after the exacerbations down a little further each time in terms of debilitating disease. And for chronic patients, most of them are having unrelenting kind of mindsets about this is never going away, and that can really play into their psychological well-being if it's a physical illness that just won't go away. And if it's a chronic mental illness, that's why it's so hard for people to handle and cope with it. These are just the 5 stages. I won't read those to you, but it kind of makes sense. Someone has symptoms, until the symptoms begin to be fully recognized or put together in your mind, or happen frequent enough, then you tend to be seeing yourself as sick, and you start to take on the role of being sick, and then you decide, well, it's worse enough, I need to go seek professional care, and then you have to give away some of the control and depend on others to care for you, and then you hope that the outcome of that care is then going to lead to recovery. And so that is kind of the normal process. Health protection and levels of prevention. This is an important slide. Make sure that you really kind of get these definitions down well. You'll probably see some questions that deal with this. What is primary health prevention? It's to prevent or slow the onset of the disease. What is secondary prevention? That is, actions that we take to screen for disease or detect early illness. And there's a slide where we talk about that with blood pressure screenings. And then tertiary is actions, things that you can either do to stop the disease altogether, or if the disease can't be stopped, you're trying to kind of see what you can do to rehabilitate to a level that's acceptable. The Healthy People 2020 report, I've got you a link on the week 13 that you can look at more detail. But this is something that they've been following for several years, trying to look at the health of America. And so they have national goals for every 10 years to kind of improve the health of the citizenship. And it tracks nationally over 42 public health topic areas. And I want to show you some of these. If you look to the right side of the screen, this was kind of an update from 2014. We have made strides in fewer adults smoking, fewer children being exposed to secondhand smoke, more adults meeting physical activity targets, and fewer adolescents using alcohol, which is ETOH, or illicit drugs. Then in areas that were getting worse, suicide, adolescent major depressions, and dental visits. And then you can see this huge list of items where really lots of work still needs to go on all these things on this slide, but many of the things that they've had lots of interventions have not improved. These are some of the main strategies and issues that you will see that deal with the things that we're trying to accomplish. The MyPlate process was an educational piece to kind of help people understand portion control and drink more water, lower fats, and different things that help you kind of have a more appropriate diet. Exercise, pretty prescribe. Lifestyle things that are out there that help improve your health. And then look at things that can be improved in the health environments for people in terms of their health. And then one thing, I won't read all this to you, but I want you to look at table 42.1 and really review that for your test, if you will.